The prostate is a gland of the male reproductive system, located in the lower part of the abdomen, in particular under the bladder and in front of the rectum. With a weight of just 20 grams, a length of 3 centimeters, and a width of 4 centimeters, the prostate has a shape and dimensions reminiscent of a walnut or a chestnut. The main function of the prostate gland is to produce prostatic fluid, a liquid that makes up 25% of the composition of seminal fluid and performs various functions. Increases sperm motility and neutralizes vaginal secretions to ensure longer spermatozoa survival. The prostate, like all organs, can become the target of malignant tumor pathologies, in which there is an abnormal growth of the cells lining the organ internally. According to the latest estimates, in Italy, prostate cancer is the most common tumor in the male population, and about 40,000 new cases are recorded every year. Survival 5 years after diagnosis is on average 92%, a percentage among the highest in the case of cancer, especially if we consider the advanced average age of the patients. Contrary to what many think, women also have a kind of prostate called Skene's glands. They are located near the opening of the urethra and play an important role in sexual arousal by secreting a clear, viscous liquid that acts as a lubricant. Female prostate cancer is extremely rare, accounting for 0.003% of all genital urinary tract cancers. In this video, we will talk exclusively about male prostate cancer, which instead represents 18.5% of all cancers diagnosed in men. In the next video instead, we will see what are the symptoms of breast cancer, the most frequent oncological disease in the female gender. What are the symptoms of prostate cancer? In the initial stages, prostate cancer is asymptomatic, so the subject does not experience any symptoms. However, as the tumor mass grows, some urinary symptoms may be felt. Let's see what they are. Trouble peeing. A general difficulty urinating is called dysuria and is often caused by urinary tract infections, especially bacterial etiology. When the difficulty of urinating is also accompanied by a sensation of pain and burning, it is called stranguria. In the case of prostate cancer, the difficulty in urinating is due to the pressure that the tumor mass exerts on the urethra, an anatomical channel that allows the expulsion of urine and seminal fluid outside the body. This is because as the tumor grows, it compresses the urethra and partially blocks the flow of urine. You will thus feel a sensation of incomplete emptying of the bladder caused by the presence of a residual amount of urine. Frequent urination. Frequent urination, referred to as pollakiuria, indicates a medical condition in which the urge to urinate becomes more and more frequent and urgent, forcing sufferers to go to the bathroom several times during the day. When the stimulus is so strong as to interrupt night rest, it is called nocturia and forces the patient to wake up and get out of bed to urinate, even more than once during the night. In the case of prostate cancer, when the tumor mass has reached a certain size, it begins to press on the bladder, causing a sudden increase in the frequency of urination. Presence of blood in the urine or in the seminal fluid. The presence of blood in the urine is called hematuria and can be caused by certain problems in the urinary tract, from the kidneys to the ureters, from the bladder to the urethra. When, on the other hand, traces of blood are found in the seminal fluid, it is referred to as hematospermia. It is a rather rare event and is due to the rupture of some blood vessels along the route that is traveled by the seminal fluid. Both hematuria and hematospermia, in rare cases however, can be the consequence of prostate cancer. In this case, it means that the tumor is already in a more advanced stage and may have already given rise to metastasis, that is, when the tumor cells move and multiply in other areas of the body, different from the original site of the malignant neoplasm. Prostate cancer usually tends to spread to the regional lymph nodes and bones, but in some cases it can also spread to the liver and lungs. Bone metastasis can be very painful and can cause bone pain, skeletal fractures, and spinal cord compression, resulting in leg weakness and urinary and fecal incontinence. Prostate cancer diagnosis. Since the symptoms of prostate cancer in the early stages are almost non-existent, the diagnosis is made through a physical examination or through blood tests. The first consists of a urological visit and related rectal exploration, a very important exam that allows to obtain valuable information on the shape, volume, and consistency of the prostate. Even if it allows only the back of the prostate to be evaluated, it is precisely here that 85% of tumors originate. The examination consists in palpation of the prostatic surface through the introduction of the gloved index finger into the patient's anus. Another diagnostic test is the dosage of PSA, an acronym for prostate-specific antigen. It is an enzyme produced by prostate cells, which has the task of making seminal fluid more fluid, thus allowing spermatozoa to move more easily through the uterine cervix. Under normal conditions, PSA is present in the blood in small quantities, but in the case of prostate cancer, its levels can increase. However, the PSA dosage can be altered for many reasons, for example, for benign pathologies of the prostate, for renal insufficiency, for the use of very common drugs, and even by the use of the bicycle in the days preceding the exam. The fundamental diagnostic test in the diagnosis of prostate cancer is the prostate biopsy technique that allows the taking of small samples of prostate tissue to be able to then observe them under a microscope and search for the possible presence of cancer cells. Final considerations. The urinary symptoms do not necessarily have to be due to prostate cancer, but also to prostate problems of a benign nature. This is the case, for example, with prostatic hypertrophy, that is a non-cancerous enlargement of the prostate gland due to an increase in its volume. It is very common in men, and the symptoms it causes are similar to those of early-stage prostate cancer. If you experience certain urinary problems, it is important to always contact your doctor or specialist in order to carry out all the necessary tests to get a clearer picture of your medical condition.